I want to thank everyone for being here again today. One issue, Mr. Chairman, I want to raise before I get to my questions is in New Mexico, thousands of tribal members over the last couple of years have fell victim to extensive sober home Medicaid fraud schemes where people were being kidnapped and driven 100 miles away into the state of Arizona under the false promise of treatment, left there without means to return home, left homeless when they were at their most vulnerable state. And while this has been tragic, not just to the families, but to everyone that has paid attention to this, to the entire community, it also highlighted the extreme need in communities to have more treatment. And I very much appreciate the conversations being had today in all spaces, especially the line of questioning coming from Senator Cortez Masto and Senator Smith. I certainly agree with their assessments. Now, Councilman Kirk, it's my understanding that there is a presence of a treatment facility on your tribal lands to help reduce overdose deaths and overall substance use disorder. Is that facility making a difference?
Right now with the facility, we're waiting on sprinkler systems, and also with it being an old residential place, we have to do commercial water, commercial sewer, so that continues to back up. There is 12 beds down at the bottom of it. So right now, what's going on in Montana is that throughout the region of the Rocky Mountain region, tribes that cover Montana, Idaho, and Wyoming, there's a regional healing center right now that's being going right now that we're starting from the ground up and working on it, trying to get a 62-bed facility. Right now, I believe it's about $28 million to get it going, but that's for all the tribes. So if we're able to, get funding with that and also bring the holistic healings and everything that need to happen with that, that would be great. But as for this facility back home, it has not been going for the past 5 years.
So that facility needs help.
Yep.
And so let me ask the question differently, Councilman. Will more treatment facilities closer to home make a difference?
Yes, because we also, all the way in northeastern Montana, have victims of being left down in Arizona, and we're still continuing to fly them back. As of yesterday, we got a woman back and paying for her luggage and everything to get back home. So we are also subject to that too. So
I appreciate that, Councilman. Now, Dr. Soto, in your written testimony, you discuss a study you authored on medications for opioid use disorders in Indian health clinics. Were these IHS clinics urban Indian organizations or tribally run clinics? Dr. Soto, we can't hear you.
I'm sorry. Can you repeat the question, please?
In your written testimony, you discuss a study you authored on medications for opioid use disorders in Indian health clinics. Were these IHS clinics urban Indian organizations or tribally run clinics?
Yes, they were urban Indian health clinics and tribal health programs and urban Indian health clinics as well throughout the state of California, as California does have over 50 Indian health clinics in the state.
From your research, how available is culturally competent treatment for American Indians and Alaska Natives in the IHS system, in the UIO system, or in other clinical settings?
Yes, it's offered, and I really want to advocate for the need for more of culture being integrated into our programs. I can't stress it enough. I'm a behavioral health scientist working with our tribal communities, and I have just learned in engaging and talking with them that culture really is the foundation of our Native people. It's been there before colonization, and it's still strong and alive today. And it really has what kept our people resilient against systemic racism, structural violence, all the things that we are talking about. And these are really essential to be able to help our communities recover. So it's good for prevention as well as recovering, because without this, people in recovery need these cultural ways to heal. There's so much there's so much grief, and there's so much healing in our community, as I've heard many say today. And so there's a lot of untended grief. Like, we need more of that and more of that healing. So having our traditional ways, and that may be very different for many of our different communities, drumming, dancing, song, traditional ceremonies, bringing in our community, our elders. And one of the other things that we've learned is it would be great as they're advocating to approve, reimbursements by tribal clinics for the cost of traditional healing services, healers themselves, or these services to help bring them into these programs. So they have them, but it's takes a lot of resources. It takes a lot of time, but to have those would really help support because culture is essential. And as many have said, culture is prevention and culture is the way of life.
And Dr. Soto, the data that I've seen shows that this works. I mean, I think that it's something I fully support and I've seen work, especially with lessons I've learned from leaders on the Navajo Nation. So I'm hopeful we can find a path forward there. If I may, Mr. Chairman, I do have one question that is technical to Dr. Soto, and it's about purchase referred care coverage for AIAN patients living outside their service area. Does that present an obstacle to accessing medication-assisted treatment to Matt?
I guess it just depends on who has it, but that purchase referred care is additional funding. It's never enough. Sometimes one person can take that entire cost as they may need that to help support their travel or for them to support their rehab, to support the service that they need that may not be offered at that clinic because every clinic is obviously very different. Not some are not specialized in certain services. And so that is really important for us to think about. So I really appreciate that comment because more funding needs to go within that as well because, yeah, it's not quite reaching all of our communities or individuals when support is needed.
Thank you for that very much. And Mr. Chairman, I do have other questions. I'll submit them into the record. But just to reiterate from what Senator Smith and Senator Cortez Masto said, associated with resources to the Bureau of Indian Affairs to be more supportive as well in planning and jurisdictional questions, I hope that there can be time for us to have a conversation about cross-commissioning and MOUs. In New Mexico, I constantly hear that liability is an issue where there's an unwillingness sometimes to enter into these agreements, and I don't understand that. But if that is an impediment, then what can be done through the Bureau of Indian Affairs or others to address those issues so that we have more eyes, more ears, more people on the ground to keep us safer? I always felt safer when there were more patrols through where I lived, as opposed to fewer patrols. Living adjacent to Nambe Pueblo and Poake Pueblo and in the communities where I live and where I have the honor of visiting, those constraints are making it less safe for people as opposed to more safe, not supporting that. And then lastly, with the Bureau of Indian Affairs, as more conversations are taking place specific to law enforcement, I certainly hope that we can gather and have a much larger conversation about the Bureau of Indian Affairs being supportive of sovereign nations as opposed to punitive in many areas. I think the times have definitely grown and moved and matured from the inception of the Bureau of Indian Affairs as we look to what that could become to provide more support to our sovereign nations and to our brothers and sisters. So thank you, Mr. Chairman, and thank you all again for being here today. I really appreciate it.